Assalamu alaikum. Dr. Hussain Bashkolachi YouTube channel is with you, and today we shall also discuss the Iran healthcare under fire and under attack, and how this system is working, and what are the learning lessons for us and for the future also. I hope this will give a new kind of understanding that in an extreme situation, while superpower and asymmetrical war is going on, and two nuclear power are combined and attacking a one third world country, and even the Strait of Hormuz, which is the supply line not only for the uh, uh, gas and petrol, but it is also supply line for the food, medicine, as well as the other items which are required, and even the internet. And these facilities are also in the bottom of the ocean, which is very near or directly coming from the state of Hormuz. And if this information technology and all these disruption escalate and go beyond the control of the human forces or political and moral boundaries, then what will happen? So let us see what is a few things which we can share with you as a public health, especially because health injuries, medical care system is not discussed in the mainstream media. So I am trying to give you some kind of information. So healthcare under fire is the heading, and it is 28th March. Almost 30 days have been gone, and war is not stopping, and only rhetoric and other political statements are coming, and some peace initiatives are there. Maintaining medical operations in conflict zone. You can see that the pillars are supply chain hardening, telemedicine integration, leveraging remote diagnostic support to maximize limited specialist availability, disturbing distributing surgical capacity to secondary facilities to mitigate the burden, and implementing uh, RAID, radio, RAID and local first procurement to bypass the traditional logistic bottlenecks. So the bottlenecks should be uh, yes, implementing redundant local first aid procurement to bypass the traditional logistic bottlenecks, and as well as distributing surgical capacity, because most of the wounds are surgical in nature. They require trauma, bullet injuries, as well as bombs and missile injuries. The coverage of geopolitical volatility and critical infrastructure constraints demand a resilient, adaptive approach to medical logistics. So, logistics are supplies are important. As of 26, the operational landscape in Iran uh, necessitates a shift from traditional supply chain to decentralized, high quality medical network. So this is the message which is important coming from the Iran. Then crisis condition, the current operational environment is defined by extreme scarcity and systemic failure, requiring immediate intervention across the critical sectors. Hospital saturation, thousands of war trauma patients exceeding existing capacity, resource depletion, severe ongoing shortage of essential medication and surgical equipment, infrastructure collapse, widespread power outage and water supply cut off. The Power outage is affecting the cold chain because most of the medicine they require uh, cold temperature to keep their shelf life intact. Communication blackout. This is another new term. Blackout and lockdowns are there, but here communication blackout, frequent and prolonged internet shutdowns, hindering the coordination. Then emergency adaptation, triage and prioritization. These are the two key words I think the lesson should be: supervision of non-urgent surgeries and rapid discharge of stable patients to clear space. Rapid discharge and operational improvisation. The local uh, and the local experience as well as relying on generators for essential surgery and life support. And even they have improvised the incubators for the children. Lessons for future resilience. Medical infrastructure resilience. Invest in decentralized, self-sufficient infrastructure, localized manufacturing for essential medical supplies, and predefined crisis mode trauma protocol. So trauma protocol should be available for the doctors and for the protecting the mission. Medical neutrality is the main mission. You are not part of this crisis, and this crisis is not because of you. It was told that even in Israel, most of the army people, most of the doctors, professionals, they are leaving this country, and same can happen in other countries, whether it is the Gulf countries or Iran. But I think the Iran healthcare system is maintaining because only less than 20 medical personnel are reported by the WHO in 14 hospital out of 400 hospital. Most of the hospital are working underground and they have all the protection. Even the geography of the Iran is a hilly terrain, so direct bullets or other things are not hitting. And even the healthcare, health houses, as well as primary health care, though under attack, but I think is dealing most of the problems at a local level, and the situation is still under control, though the firing and attacks are everywhere. Second is staff support, implementing robust mental health and security protocol to combat burnout and physical danger, fatigue and other things, and physical danger. There should be a protocol and continuity planning for logistic coordination in the absence of digital network. If the digital network is not working, then how to uh, organize the logistic or the supply line, drugs, and even the specialist care and manpower. With this, I think we are ending this, and this is the 28th day of the war, and the whole world, including the medical landscape, is changing every minute and every second. My sympathy is with the doctors of the Iran and the doctors in the conflict zone, whether it is any country, either it is Israel. And today it was heartening that in the Rome city, the mothers of Israeli mothers and the Palestinian mothers, they walked barefoot and they were taking the banner, and their the main demand was that our children should not be killed. And that photograph and that scene is that still the humanity is alive, still the children life is precious, and still the hostilities are manageable. If the Palestinian mothers barefooted walking in the Rome, this is unheard, and this is a message I think every country should learn. And this is the inspiring message for the doctors that with you, the mothers of Israel, mothers of the Palestinian, they are for the life, not for the fight. Thank you very much. Please like, share Dr. Hussain Bashpolachi YouTube channel. And if anything which is giving you latest information on public health, as I am professor of community medicine and public health and fellow of College of Physician Surgeon, it is my duty that I should speak out for the doctors, nurses, healthcare providers, and to protect the hospitals and healthcare system of every country, including Iran. And there is no international law that you can kill children, you can kill the hospital, you can kill the school children. And I think the Palestinian mothers and Israeli mothers, hand in hand, barefooted in the Rome, have given a strong message to United Nations and WHO. And I think that is a message which has inspired us and entire healthcare system that humanity is alive, medical profession is alive. Thank you very much.